At Health Partnership, they have become, for me, exactly what their name is. It's been a partnership between them and me on improving my health care.
Prior to having access to Health Partnership Clinic, I didn't go to the doctor unless I was literally thought I was dying. It just wasn't an option.
Just thank God that the Health Partnership Clinic do exist, because if they didn't exist, I wouldn't know what I would have done.
The Health Partnership Clinic has been treating the low-income uninsured of Johnson County since 1992. With a small paid staff and scores of volunteers, Health Partnership Clinic treats those who can't afford care, can't afford insurance, and can't afford to miss work.
The Health Partnership Clinic is a haven of hope, healing, and safety for those who would be destitute and helpless without a medical home to go to.
The clinic was formed as a community outreach to meet the need for charitable health services. Every hospital in the county came together as equal partners to provide financial support and resources. Each one accepts at no charge patients referred by physicians at Health Partnership Clinic for in-kind laboratory and radiology services. In the last fiscal year, that donation totaled $1.5 million.
Where do you see direct competitors, for-profits, not-for-profits, faith-based, not faith-based, community hospitals, all around the table, all working toward the same goal, and that's figuring out how to take care of those who don't have insurance and prevent their health conditions from becoming worse.
I had a rare type of cancer in 2001 and was in medical treatment for about a year and a half. And not long after I finished my last chemo session, I lost my health insurance.
I have pre-existing conditions, so there is not one insurance company in this country that'll take me. So I have joined the 47 million people in this country that have no health insurance, and at really no fault to my own.
I have never been out of a job, and I've been working ever since I was a teenager and stuff. And it really shocked me to know that I was out of a job and didn't have insurance and didn't know where I was going.
After 6 months layoff, I spent all my savings and my house, paid mortgage, paid service, got everything, because I don't have any money coming in.
More than 55,000 of your Johnson County neighbors are uninsured. The Health Partnership Clinic serves those whose income falls below 200% of the poverty level. A family of 4 making less than $44,000 qualifies for clinic care.
The need continues to grow as not only the population grows, but also as the economy becomes stressed. A lot of individuals who were on more secure financial grounds now find themselves without health coverage.
I believe that there's a big misconception that people that live in Johnson County don't need any kind of assistance, whether it be medical, food, anything like that.
Well, there's a lot of people that we never know that are our friends and our neighbors, the guy next door, that you would never expect to know that they're using the services of the Health Partnership.
Maybe people just don't know that these type of services exist in Johnson County.
Without the clinic, overcrowded emergency rooms would be the only place patients could turn for their primary source of care, leading to more expensive care for our community as hospitals absorb the costs of uncompensated care.
Emergency departments are some of the costliest medical care available in the medical system. A doctor's office is much less overhead. The technology needed is much less.
It creates a larger burden on the healthcare system when people recognize, because there is no free ride. When somebody is seen, it's technically not free. Somebody will pay for that, either directly or indirectly.
Patients with no primary care provider often suffer devastating consequences to both their health and finances. Diseases and conditions can become chronic, driving up their debt, reducing their chance for recovery, and taking them out of the productive workforce.
A healthy population is a better workforce. A healthy population costs us all a lot less money if they don't access the system more. So what we're trying to do is keep people from, through the Health Partnership, is to keep people from getting sicker. We want to promote wellness.
Nearly 90% of the clinic's patients are adults, and more than half of them are employed.
I'm a full-time nursing student at Research College of Nursing, and that takes up a huge chunk of my time. And I work part-time, waiting tables to make ends meet, and it's just a struggle.
Patients come from all ethnic groups, with 45% Caucasian and 38% Hispanic, such as Miguel, who came to Kansas City from Spain. This year, the clinic will schedule an estimated 10,000 patient visits. Last year, from its 2 locations at 95th and Metcalf and in Olathe, where dental services are also offered, the clinic provided nearly 2,800 hours of volunteer service. Many of the care providers volunteer time on their days off. Others are retired and are looking to give back to their community.
It's so gratifying to make a difference in somebody's life, especially when people here are very grateful, because they know what you're giving up.
Family practitioners and specialists offer many procedures and lab services on site.
I go there for my high blood pressure, I go there for my cholesterol, I go there for my yearly pap smear.
For specialty care not available at the clinic, physicians refer patients to the Wyandotte Johnson County Care Referral Network.
The out services where they have sent me, whether it be to the laboratory to get a test done at one of the hospitals in the laboratories, they treat you like anyone else.
Volunteer staff provide support from care to counseling to clerical. Besides health screenings, physicals, and well-woman exams and health fairs, a volunteer nurse teaches 2 diabetes education classes each month.
There's always a great level of satisfaction seeing a patient improve because of some teaching they received and because of their understanding of their disease.
It's people who just want to be a part of something that's bigger than themselves and bigger than they can accomplish all by themselves. We don't know what we'd do without our volunteers.
Of the 13 paid staff at both clinics, more than half are bilingual to better serve the diverse patient population. Many patients make a suggested donation for visits.
And when I go to the clinic, I will make a donation, whatever I can afford.
We sometimes give you donations, $10, $20, depending on how you have, It's nothing in comparison to what these people do it for us.
Every time I've walked in the door over there, I've always had this little fantasy run in my mind. I wish I could write them a check for 10 grand. Because they need it. They need all the support they can get.
Regardless of whether they contribute or not, each patient receives the same high-quality treatment any county resident would expect at a health clinic.
When I go there, they treat me as to the utmost respect, and just sitting there waiting for them to call me for my appointment, just seeing different kind of people come in, they treat all of us the same.
I've been treated as if I'm a medical patient in a very fine clinic with fine doctors.
For the care that I get there and the compassion and the graciousness, and the staff always goes above and beyond to accommodate me and my needs or problems that I'm having.
Part of the experience here is make it so the patients feel comfortable coming back. You have to make it that, otherwise you lose the continuity of care.
The Health Partnership Clinic partners with healthcare providers, hospitals, civic organizations, and more than 80 volunteers to prevent and treat disease, as well as manage and control chronic conditions. These efforts improve the health of Johnson Countyans while helping control healthcare costs.
Health Partnership Clinic, it's been a blessing. It truly has been a godsend.
I never finish appreciate what these people do for us. Yeah, it's amazing.
It gave me salvation to know that health-wise, I'm being taken care of.
Johnson Countyans are generous. If they know of the need and they know of the problem, they'll address the problem. We need resources to help further expand that care so that the volunteers can provide the type of health care coverage that these folks deserve.